And welcome to our daily briefing from the COVID-19 Task Force. Today is Thursday, the 26th of March. We're closing in on 5:30, and once again we have plenty of news for you here from the operations center here. We'll start, as we usually do, with Lloyd Phillips, who is the Commissioner of Public Safety here in Kahnawake. Just a little note, and this, just to give you an idea that we do pay attention to what you say, because when we go live we get a lot of comments that come in, and somebody mentioned yesterday that when we come in here, geez, we should either disinfect the podium beforehand, before each speaker. So actually we took your advice, so we are each doing that as we come in. I'm trying not to touch the podium at all, but others, may be a little different. So that's just one of the things we're doing. There's so many things that we are doing. In the office here, we are maintaining at least 6 feet between everybody who works here. The committee meets every day, and the tables are really spread out because we are all taking this very, very seriously. And, it is our privilege and honor to bring you these updates every day. We're happy to do it, but we also have to stay healthy as well in order to continue to do the work that we do. So with that, I'd just like to introduce once again a man who at this point doesn't need any introduction. You've seen him every day during the past few weeks here, but there's always something new, and we'd like to welcome him once again, our Commissioner of Public Safety, Lloyd Phillips.
There you go. Thank you, Joe. Just a quick note. I know people have been watching online, proper hand washing techniques. Actually, we posted a couple of links on the 911 page, but if you want to go on the World Health Organization, they have a good demonstration there. But even for hand sanitizer, the same principles apply. So you take a little in your hand, rub it this way, get your palms between your fingers, back of your hands, both sides, and tips of your fingers is one of the most important parts. You do a little swirl in here, and then your thumbs. So that's a quick tutorial there on, then that's a proper, you do that 20 seconds when you're soap and water, but if you're using hand sanitizer, you do the same method, then to let your hands dry in the air. So I figured I'd share that information with you today. But today, the first thing I want to address with the community is maybe some clarification on some of the past couple of days on information that was put out to the community. First thing I want to clarify and maybe address further is the decision of the task force not to continually talk about numbers of how many people in Kahnawake have the virus and such. There's a few reasons behind that. One being we don't get that detailed information on how many people specifically in Kahnawake have the virus. Everything is done in regions. And the region, like I said, I think yesterday, it's called the Monte Regi, and it's a huge area. It runs almost from the Huntington area, by the border, Ormstown, all the way up to Longueuil and down towards the border, towards Lacole. So it's a very large area, and that's the area our numbers get lumped into. Reason why we know certain numbers is because we're a small community. Sometimes people share it on their own, and so we're able to figure out numbers based upon a friend of a friend, or in some cases an employer may have certain information because the employee shared it with them. So I just wanted to make something clear on that, because also keep in mind there's the confidentiality aspect. If somebody goes see a doctor and they get a test, in this case if it's a nurse does a test, same principles apply, and the person comes back negative or positive, there's that confidentiality there. If somebody wants to knowingly let the information out that they have tested positive, that's their right, that's their prerogative. But the hospital or the doctor does not have the right to release and say, Lloyd was positive or this person was negative. They don't have that right to do so. There's legal obligations on that. I understand it's frustrating to some people saying, well, we have a right to know, or we should be able to know. Unfortunately, you don't. There's legal obligations. And how would you feel as an individual if you got tested and you were positive and people start pinpointing at you? Secondly, I don't want to make sure the spotlight is not on the individuals who unfortunately contracted the virus. They are under enough pressure, and they're scared. They don't know what the next steps are going to be. So I don't want to put a spotlight on them and put more pressure on them to either reveal who they are or have questions in and around them. In many cases, some of them feel very bad that they actually contracted the disease and potentially spread it to others. So I don't want to put that on individuals. I think we should be bigger than that as a community and stick by our fellow Kahnawake and support them in a very tough time. And lastly, I don't want to talk about numbers, even though they'll be sketchy at best. But to put a spotlight on Kahnawake, to make it look like there's an outbreak, in Kahnawake itself. Matter of fact, I did an interview yesterday with CBC, and that was the opening question. It says, well, Mr. Phillips, how do you feel that there is an outbreak of COVID-19 in your community? And I had to correct him and say, well, first of all, I don't view it as an outbreak, because just because we revealed certain information to the community doesn't make it an outbreak. We don't know what the numbers are in our neighboring communities, and specifically in Chattagee or Dawson or wherever. We were just fortunate that we had some information at that particular time. And so it gives that impression externally as well as internally, and it causes unnecessary fear. Because we had people saying that, oh my God, Kahnawake, there's so many cases, and there's none in Chattagee, there's none in Dawson, but what about us? How can we have so many cases? So if we keep harping on that, it'll cause more fear. And the last thing that I want to do as the chair of the COVID task force is to create fear in the community. We're here to try to provide facts, provide information, and alleviate as much as we possibly can the fears from our community members. It is a tough time. Yes, I acknowledge there is a level of fear out there. Everybody's taking this very seriously, but if we manage our fears, listen to the facts, listen to each other, support one another as a community, we will get through this together. With that said, and I want to repeat myself from a comment I made before, because sometimes it's worth repeating because you may not have heard it the first time or maybe not even the second time. But we are a more vulnerable population than our neighbors. Simply because the fact, like I said before, we all live here. Our brothers and sisters are just down the road. Our uncles and aunts are down the street. The other side of town live maybe your grandparents or your parents. So we're all a close-knit family. So we're all interconnected in different ways. That's why we know certain information about people who are positive, but that also makes us more vulnerable because we have our families close by. That's why it's even more important when we talk about staying home, about not visiting, about abiding by the recommendation and directives, is because we are more vulnerable. So it's not time to go reach out and say, I want to go visit my brother or my sister or so on. You want to stay in your home with the people who you normally live with. We do that, we lessen the potential impact on our community. And if when there's going to be transmission of the virus, it's at a slow pace where it's manageable, and we could properly have people get their medical care if they need it, and minimize, again, that impact. Also, I want to acknowledge the fact that people are scared. But keep in mind, the vast majority of people who do contract the coronavirus or COVID-19, do make a full recovery. Many of them won't even show major signs or symptoms. And a few will feel horrible, but they'll get through it. Even fewer will need hospitalization. And again, yet fewer than that, unfortunately, there are a small percentage that will succumb to the virus. So even though you hear, we hear, these numbers out there on the news media 24/7 about how many deaths there are, unfortunately, most times you look, they don't tell you how many people recovered or how many people survived. So just keep that in mind. We have to be vigilant. We have to be careful. Like I said, there's a vulnerable population out there that we have to protect. So, but also keep in mind, a vast majority of people will not get very, very sick from this virus. Now, our best defense at this point is still to be social distancing and abiding by the directives and staying home as much as possible. On a different note, I just want to mention today there was a couple of other directives that were issued by the task force. One was first and foremost to all the community employees who are now the front line, the essential service workers in the community. So when they return home after work, they are to remove their clothes, ideally in an entranceway, but not go into the home and get undressed in your room. As soon as you enter the home, get undressed, bag your clothes, and bring them downstairs or wherever your wash machine is, and wash them as soon as possible. If they're not soiled, another option is also you take your clothes, you could throw them in the dryer on a high setting for a minimum of 30 minutes. That's an additional way of making sure you're killing the virus. This is again an additional measure we're doing for our essential service workers, our frontline staff in the community, to minimize the transmission of a virus that you may have picked up throughout the day, minimize it going into your home. And it's highly, highly recommended for all other people. It is mandatory for everybody who works, but for people who don't work for one of the organizations or work for the community in that capacity, it's highly recommended for you as well. You're out and about in the community, you go home, take the same precautions. Don't risk transmitting that virus from yourself throughout your household. Also, the directive was given to the environmental health officers through KSCS as well as the Labor Office of MCK to monitor all the essential service businesses and organizations that are still operating. As we know, the vast majority of businesses have closed. Many services within MCK and other entities have also closed. But we have inspectors who are going to be going around to making sure that people are compliant, making sure proper safety regulations are being followed, social distancing, proper sanitation, and so on are taken into account to ensure people are safe within the workspace. Another one that was released today is in response to many of the questions that people been asking, either on Facebook or directly to the task force. Many questions about on the medical aspect. So today we announced that we are going to start a questions at mck.ca as well as on Facebook. You can ask questions, medical questions. If you're not sure on a specific situation, send those questions in. We have a medical doctor, Dr. Gauthier, will be reviewing those. And matter of fact, we'll be here tomorrow to answer a lot of your questions live here on the air tomorrow at our update. So that's going to be something we'll do initially. And if it needs to be done as time goes on, I'm certainly open to making sure that people have the ability to ask their questions and get answers directly here from a physician who works in our community. Because I know sometimes you watch the news, as I do. I watch CBC News. I hear what they got to say. I was listening to CTV News. I'll put it on CNN just to see what's happening out there. And everybody has their specialist and their doctor they speak to. And unfortunately, sometimes the message is not always 100% clear, or there is some discrepancies in what they're saying. I look local, and what our local experts give the advice upon is what I relay back to the community, and that's what I formed the directives upon, and the task force forms the directives based upon information from our local professionals who have a vast network. It's not only them, they have a vast network out there connecting with the hospitals such as the Jewish General Hospital and various McGill universities, and they have a large network of people they could draw upon. So it's not just one doctor, it's a whole network, and we have that fortunate here to be able to bring that information based on all this filtered down to the community that helps drive us on what we do. So you have those questions out there, I urge you to use the Facebook or questions at mck.ca, and we'll sift through the questions, and we'll do our best to answer as many as we can. And then, if need be, we will repeat that in the coming days. On a final note for this evening, I just want to address one topic, and hopefully this is going to be for the last time. The question was raised again about blocking off our borders in an attempt to further protect our community. I have to just say, we're fighting an invisible enemy. Blocking off our borders will not stop that. As we've seen, the virus is here in the community. So that is not something that would be of benefit to our community. A matter of fact, it may interrupt or hurt essential services. It may interrupt or hurt deliveries coming into our community. It may give the wrong impression for people who we're dependent upon to bring food to our community or deliver propane or gasoline or such. So that's not an area that I think is something that would be advisable to our community at all. Plus, it'll add another level of fear. Last thing we want to do is have more fear in our community. So I want to address that one last time, and because it's something that it came up again, and it's something we totally advise against. It's something the peacekeepers are monitoring. It was looked at, and at this point, it's not something that it needs to be further discussed. Like I said, because unfortunately, the virus is here in our community, and actually, Lisa is here to discuss many things in and around the virus. Also, to make some announcements on some of the work that the COVID task force has done, and some other interesting information in and around that. So with that, I'll turn over the microphone to Joe, who will come back up here for a minute, and then I'll see you again tomorrow. Onigiwahi, stay safe.
Yeah, now, Lloyd, just a little note. Once again, for people who want to ask medically based questions, send them to questions at MCK, questions at mck.ca. Do it now. If you're watching this live, now's a chance to do that, because we need time for the doctor to actually make sure she has a chance to do research in case that's needed. So that's just an important note. Also, we won't be doing actually live question and answer tomorrow. She will do, though, do a recap of the actions that will take place tomorrow in terms of answering some of these questions, and hopefully that'll help to get people's minds at ease. So once again, coming up is Lisa Westaway, the Executive Director and Spokesperson for the Kahnawake Memorial Hospital Centre. She does have a major announcement to make. Of course, she'll lead in with some other information as well. So Lisa, the floor is yours.
Good afternoon. So I'm here to talk about a few different things today. The first is to address rumors and questions that that I've been hearing or that are going on actually about the hospital. So some of the questions that I've heard are, what are they hiding? What's going on at the hospital? Why are there all the cases coming from the hospital? And again, what are they hiding? So I really want to address those questions. I think they're important. I think it's important that we talk about them. So firstly, I want to start off by saying we are not hiding anything. In fact, it's the complete opposite. I come here day after day purposely to provide as much information, clear, factual information as possible to each and every one of you. I committed to that, and I will continue to do that, and that is why I'm putting these questions out into the forefront today so that we can address them together. So what is happening in the hospital? Let me answer that question. I think that, you know, what is known, what is already very public, are some very public announcements from staff members who did announce that they were positive cases. And yes, there are a couple of other positive cases in the hospital, and in fact, to be clear, in outpatient care. And it does just so happen that these cases and this transmission occurred several weeks ago, and unfortunately before all of the discussions and talks about social distancing were so prominent in our instructions. What I can tell you about this, what are we doing about this, is we are containing it. So the contacts, our original contacts, so our 2 public cases, the contacts of those people have been off, and therefore we may have identified new cases, but those people have not been at work. So this is called containment, and this is what social isolation is all about. It's about being able to minimize the transmission as much as possible, and in fact that is exactly what we've been doing at the hospital. So we don't, the other element, and Lloyd touched upon it a little bit when he spoke to you, is about the spotlight that we've placed on the hospital and on the community. So by us being as transparent as we have been, we have put a spotlight on the community, but on the hospital in particular, because you are aware of our positive cases. You know where they came from. We've told you about it, or they've been identified in social media. However, don't let this fool you. There are other positive cases in the community. This is not just in the hospital. However, we are not necessarily testing everybody in the community. Now that brings another point that's very important. Public health, in our discussions, and I speak to them many times a day, are quite certain that we have community transmission here in Kahnawake. So when you ask what are you doing about it, what is the answer to this? Well, for a couple of weeks now, we've been working on creating a testing site here in Kahnawake. So we're happy to announce today that we'll be opening that testing site on Saturday afternoon. All of the elements and logistics are still being put in place. It's actually a lot more complicated than hopefully it will seem to you when you drive through. But we hope, and our goal is to be able to schedule our first appointments on Saturday at 2 o'clock. So this will be a drive-through testing site. It will be on the side of the Academy Memorial Hospital. I don't have very good spatial orientation, so it's where the handicap entrance is, and we'll be setting up heated tents where nurses and administrators will be able to ensure that you have your test done in a very safe, secure environment. Also, this site will test on appointment, and so we'll be providing to you by the end of the day tomorrow, so that will be part of our announcements tomorrow, all of the details about how to make an appointment. It's really important that if you have symptoms, you get tested. We can't test before there are symptoms, because then it's not an accurate test. Your result may be negative. When you could potentially develop symptoms later, it gives you a bit of false information. So we test when we have symptoms. Now symptoms, the actual symptoms that we've always talked about are cough, fever, and or respiratory problems. Today it was announced that there are 2 other symptoms that were added to the list that will give people the ability, or that should indicate testing, and that is loss of taste and loss of smell. So those 2 have been added to the list, and we'll put some information on our Facebook page and our KMHC page to update that, and it will mean that we'll be updating our screening. We just found this out about 5 minutes before I came on, so we'll have to update our screening as well in the hospital. So this is something new that public health has added on to the list of symptoms today. So I hope that I've addressed the rumors. the questions we get often is, are people afraid? Are your staff scared to come to work? And the answer is yes, we're all afraid. We all feel inside what you are all feeling in the community. We're all feeling that on a day-to-day basis. We all worry that we're going to bring the virus home to our families, to our grandparents, but we know that this is an important job that we have to continue to do, and therefore our staff and all the staff of our essential service workers, we all go into work on a day-to-day basis with this fear. And we do it with gratitude, but with happiness, because we know that this is part of our role right now. This is our responsibility. I guess one thing that I really wanted to reassure all of you about was about our inpatient. We haven't talked much about that, but I want to reassure those family members, children, community members, that there are no positive cases in inpatient as of right this moment. Yes, we do test, because we test as soon as we feel that there's a risk, and every test that we have done in inpatient has been negative. So I just wanted to reassure you, we have extreme measures and safety precautions in place in inpatient, and we are very proud with the measures that have been implemented and the way that staff are working hard to ensure that inpatient residents are protected. So I wanted to give that information, and well, I guess that's it for my update today. So thank you very much.
Well, thank you very much, Lisa. Again, some very, very big news announced today, and I guess look for more information tomorrow. A testing center right here in Kahnawake. That is no mean feat. There are not that many of them there, so the fact that we were able to get one here is really, pays tribute to the hard work that is going on behind the scenes. So once again, medical questions being answered tomorrow. You can go to questions@mck.ca. Also, the messaging functionality for Kahnawake 911. The Facebook page has now been enabled as well, from everything I understand. So send those questions. They will get answered throughout the day tomorrow by Dr. Gauthier, and she'll also report on that tomorrow, as we said earlier. So until then, just like to say thanks for watching. We'll be back tomorrow at the usual time. Just like to say a little thank you to the crew who has been helping for these past couple of weeks. I mean, I work with these guys every day, so we, kind of take, take them for granted. But Jean Daibo, Justice Polson Lahash, on other days, Dega Lazar and Skylar Taylor have been here, and they just work tirelessly behind the scenes. I know I'm here in front of the camera, but they're doing a heck of a lot of work. We have a pretty good team here to help get this information to you, among, of course, all the people on the task force and others who are helping out. So thank you for your patience. We'll see you tomorrow once again at around the same time with our next update from the COVID-19 task force. Take care of you, folks.